Jim Davidson critiques Starmer's health care policies amid worker protests. In a recent turn of events, comedian Jim Davidson has publicly criticized Labour leader Keir Starmer regarding his handling of health care policies, coinciding with a significant protest involving over 500 health care workers. This situation has sparked discussions about the future of the National Health Service (NHS) and the political landscape in the UK. The protest, organized by health care workers demanding better pay and working conditions, highlights ongoing tensions within the NHS. As the cost of living continues to rise, many employees in the health sector feel undervalued and overworked. The demonstration took place outside a Labour Party event, amplifying the stakes for Starmer, who is striving to position himself as a credible alternative to the current government. Davidson, known for his outspoken views, took to social media to express his disappointment in Starmer's approach to health care. He argued that the Labour leader needs to prioritize the concerns of health care professionals and develop a more robust plan to address their grievances. Davidson's comments have resonated with many who share similar frustrations, especially as the NHS faces unprecedented challenges. The NHS has been under immense pressure in recent years, exacerbated by the pandemic and budget constraints. Health care workers are increasingly vocal about their struggles, advocating for fair wages and improved working conditions. The protest led by health care unions seeks to draw attention to these issues, emphasizing that without adequate support, the quality of care provided will continue to suffer. Starmer's leadership has been scrutinized, with critics arguing that he has not taken a strong enough stance on health care reform. Supporters of Davidson's perspective believe that the Labour Party should be more proactive in addressing these systemic issues, rather than merely responding to them. While Davidson's critique has garnered attention, it's essential to recognize that opinions on Starmer's leadership are varied. Some supporters argue that Starmer is navigating a complex political landscape and that his focus on unity within the party is a necessary strategy. They believe that fostering collaboration among party members can ultimately lead to more effective solutions for the NHS. Conversely, detractors feel that this approach may be too cautious, particularly when urgent action is required to address health care workers' needs. The challenge for Starmer is to find a balance between maintaining party unity and responding decisively to the calls for change from health care professionals. Public protests like the one involving health care workers are crucial in a democratic society. They not only raise awareness about pressing issues but also put pressure on political leaders to take action. The visibility of these protests can influence public opinion and potentially sway political decisions. Davidson's involvement in the discussion brings a different dynamic to the conversation. His celebrity status can help draw attention to the plight of health care workers, encouraging broader public engagement. However, as a comedian, his comments should be interpreted with an understanding of the nuances involved in political discourse. As the political climate evolves, the Labour Party faces significant challenges. Starmer must consider the feedback from both supporters and critics as he formulates policies that resonate with voters. The ongoing dialogue about health care reform is not just a matter of political strategy, it impacts the lives of millions who rely on the NHS for their well-being. The protests signify a critical moment for health care workers, highlighting their demands for better treatment and support. As public sentiment shifts, politicians will need to respond to ensure they remain connected with the electorate's needs. In conclusion, Jim Davidson's criticism of Keir Starmer sheds light on the pressing issues facing health care workers in the UK. While opinions on Starmer's leadership vary, the need for substantive reforms in the NHS is clear. As discussions continue, it's vital for the public to stay informed and engaged. We encourage you to share your thoughts on this topic in the comments below. What do you think about the current state of health care in the UK? How should political leaders respond to the needs of health care professionals? Don't forget to subscribe for more updates on political news and discussions that matter to you.